We discuss it all: maternal health, vaccinations, infant nutrition, preventive care, mental, physical, and emotional wellness of both the mother and baby. We talk about what truly matters here. Tune in to Sunny 88.7 FM and also on Sunny TV every Friday morning from 9:30 a.m. to 10 a.m. Also a repeat broadcast on Saturday morning from 9:30 as we bring to you the Cradle to Crayon show. Join me and my team of doctors and health experts as we answer your questions, give you expert advice, clear all myths, and also share real solutions. Remember that informed parents raise healthy children, and healthy children build a stronger future. See you. From infancy to adolescence, from prenatal care to safe motherhood, we discuss it all: maternal health, vaccinations, infant nutrition, preventive care, mental, physical, and emotional wellness of both the mother and baby. We talk about what truly matters here. Tune in to Sunny 88.7 FM and also on Sunny TV every Friday morning from 9:30 a.m. to 10 a.m. Also a repeat broadcast on Saturday morning from 9:30 as we bring to you the Cradle to Crayon show. Join me and my team of doctors and health experts as we answer your questions, give you expert advice, clear all myths, and also share real solutions. Remember that informed parents raise healthy children, and healthy children build a stronger future. See you. From infancy to adolescence, from prenatal care to safe motherhood, we discuss it all: maternal health, vaccinations. Rainy Friday morning, we are glad, grateful to God Almighty for the gift of life. And I welcome you all to Cradle to Crayon show right here on Sunny 88.7 FM. We're live across the world on www.sunnygh.com. We say a very big thank you to our sponsor, Back Specialist Hospital and Fertility Center. In the course of the show, as we do every time, open our phone lines, get involved in the discussion. We'll have a very good time. Now, for this whole month of May, as it's done over the years, Fertility Society of Ghana, they do a campaign. This month, they say, is a yellow month. There's a lot of advocacy, community education. There's aggressive public campaign. They are talking about newborn jaundice, neonatal jaundice. They are targeting mothers, caregivers, every stakeholder, medical personnel. They want to talk about newborn jaundice and make sure this is right. Our babies are well, they are discharged home, and they live a healthy life. So this morning, I have here my doctor. She's been one of the favorite pediatricians I've had here, Dr. Anna Foko-Boedo. She's from University of Ghana Medical Center. I want to talk about newborn jaundice. Doc, good morning. Good morning. It's good to have you here. I'm happy to be here. I should have worn my yellow.
You should have, definitely.
2 years ago, I was my yellow earrings.
Your couch is yellow.
It's yellow, yes. It's complimenting me here.
Yes, it is.
Yes, how's your week been?
It's been good.
Great. Yeah. I saw you launch the campaign.
Yes, we did. Yes. On the 7th of May.
Great. Yeah. I want a background to this yellow. Why yellow month? Why the month of May? Why the entire month? Sometimes just a day, but the entire month, and why yellow?
Yeah, all right. Thank you so much. So this is on behalf of the Pediatric Society of Ghana. When you visit our neonatal units across the country, the most common condition perhaps will be neonatal jaundice.
Wow, that's the most common.
Yes, most of the cases that we have is neonatal jaundice. Over the years, we have made some progress through advocacy. However, we've had quite a number of children who did not have their jaundice identified early, and it led to lasting complications and long-term problems for them. Because this is so preventable, the Pediatric Society decided to have a campaign. This was decided in 2017, and since 2018, every May, we celebrate the Jaundice Month. And the whole month is targeted, teaching about jaundice, how to prevent it, how to spot it, and get into the right healthcare facility as soon as possible. Yellow, because jaundice is yellow, and then actually the name comes from the French word jaune. If you remember what jaune is, jaune is yellow color, right? Yeah. So that's why it's called jaundice, because jaundice shows in the eyes and in the skin as yellow. Okay. And so because we find this condition very preventable, and also if not prevented can cause such devastating results, we decided to actually campaign on this, teach people so that we can improve our chances, the Ghanaian child should not have to have long-term complications from something that could have easily been prevented.
Okay.
Right.
Okay. So for someone hearing this for the first time, neonatal jaundice or
Yes.
newborn jaundice, what is it?
What is that? Okay. So jaundice has got to do with yellowish discoloration of the skin or the white parts of the eye, which is called sclera. And it comes as a result of excessive or high levels of bilirubin in the blood. Bilirubin is a substance in the blood that is a part of red blood cell breaking down. So whenever red blood cells break down, bilirubin is released, and ideally bilirubin is excreted through urine and feces. However, there are some conditions that will predispose it to being high or reduce its excretion in the blood, in the urine and in the feces, so when that happens, your bilirubin levels go high. Bilirubin is a yellow pigment, and so then it begins to stain the skin and begins to stain the eyes also yellow.
Okay.
And if it does get to the brain, then it also stains the brain yellow. Yes.
So usually how soon after birth does it appear?
So it depends, because we have different type, or like we'll probably classify it into two types, which will be the physiological and pathological. And physiological will probably be seen after day 2 of life, day 2 to 4 of life, and pathological is seen on day 1 of life.
Day
right?
1.
So usually when you see jaundice on day 1 of life, you know that there's an underlying cause.
That's
there's a reason.
pathological.
That's a pathological, meaning that there's something wrong. There's actually an underlying illness.
The child
that is
has a condition or
something that is causing it.
Okay.
Right. Then if it comes 2 to 3 days after, then that is the physiological jaundice.
Okay.
In terms of what causes it, so first of all, with the newborn, the liver is not as matured as in like
an adult,
right? So then the liver works on the bilirubin, and so it becomes overwhelmed just because it's not up to the task. It becomes overwhelming to get rid of bilirubin in the blood. So that's one of like the basic like physiological cause. The other thing is also there's also a high red blood cell turnover in newborns, and so the rate at which the blood cells are breaking down is faster than how much the body can excrete. So that's also like a physiological cause of the jaundice, right? Then there are other causes. So you have a child who hasn't pooped. Mothers will know that the first poop is usually like some kind of green color, and that green color is because of the bilirubin that is coming out. So a child who has not pooped after a day, bilirubin is still sitting in there. A mother who has not yet started breastfeeding, because when you breastfeed, that's when you can actually bring out the bilirubin through the feces, through the urine. So if you are not making feces, if you are not making urine, then the bilirubin is building
The formula doesn't help to do that.
So formula does help, because once you're taking in your formula, either ways you are making feces and you are making urine, and so that formula does help. So a child who is probably I should say a child who is not feeding, yes, because not every mother has breast milk.
Definitely.
So
the
a child
first
who is
or
not
second
feeding,
day,
getting dehydrated, then that is already like a risk to them developing jaundice. There are so many other underlying causes. So if the mothers will know, because at antenatal we do G6PD routinely for them, right? So G6PD is glucose 6-phosphate dehydrogenase defect. It's a big word, but it's just an enzyme in the body that helps with your blood cells. And so when that is defective, it also predisposes to the blood cells breaking down. Sometimes when the baby's blood group is different from the mother's blood group, that also causes the cells to break down, and that can be seen on the first day of life. So for us as clinicians, we are able to tell based on what, and then we have like routine labs that we can do to try and identify why this child has jaundice.
Okay. I'm looking at beyond the yellow eyes, which other signs are there? Here, I'm worried about mothers who deliver vaginally. Sometimes morning baby has come, close of day you need to go home. And you said the other type, there's pathological, and the other one that doesn't show on the same day. So when she goes home, she has baby with all excitement. Baby's home. We are so careful. Families around. What signs can she pick up to make sure that this is what my baby is presenting with? I need to rush him or her back to the hospital.
Yes, thank you. So for that, it's mainly the yellow discoloration. That's
The
the
yellow.
first thing. What I'll say about that is it's best seen in sunlight. So it's good to help natural light. So it's good to see this child in natural light. You know, sometimes babies are delivered and they are indoors the whole time, but sometimes you need to bring, and knowing about jaundice, the first few days of life you need to actually come out with your sons, with your child, into the natural light, so you can actually
But
see.
you know, with typically what they say is don't bring the baby out after 7 days or so.
Yeah, so
you're
I mean,
always
this is
indoors.
Yeah, I mean, this does not mean like the person is walking around and all of that.
Okay.
But, and even you can have natural lights. Let's say you are in your hall, but your windows are open as well lit. You can actually see the color of your skin. The other thing is that with black people, sometimes it's very difficult to tell from the skin based on how dark the child is. So typically I would recommend that every mother within 48 hours of delivery, if they went home the same day, should pass by the healthcare facility to have a review. In that sense, there's those who have cesarean sections are lucky because they usually go for like 3 days or 2 days minimum. So then if there's anything, we can pick it up, which is why we're also doing the education, so help mothers to know. The other thing will probably be, you know, once there's an underlying cause. So for example, there's an infection, there are signs that the child may show. So the temperature might go high, there's a child who is refusing to eat. So not just from infections, but sometimes when jaundice is worsening and it gets to the brain, it begins to affect the child's movement. So you have a child who is just limp, not active, is not crying, refusing to eat. It's like you are feeding the child, that a child is not sucking them either from the breast or from the bottle, either way. So when you have poor feeding, when you have signs of lethargy or weakness from the child, and when you actually see that maybe this child is warm to touch, or my baby is just not looking right, those are all signs that you should come to the hospital immediately. You see that, so that we can assess to see what it is, because some infections can cause jaundice as well.
Are there some babies more likely to have it than the others, like risk factors?
Yeah, so in terms of risk factors, so preterms, so out of 10 babies, 6, if they are so for 10 babies, 6 of them out of 10 will have jaundice. But for if it's a preterm, that's 8 out of 10. So with a preterm child, already we mentioned that the babies have an immature liver to work on the bilirubin. Sometimes they get overwhelming. So if the child is preterm, it's even more so that they have that. And then if this child has an underlying condition like the G6PD, then that's already a risk factor. A child who is yet to be fed is a risk factor.
Yet to be fed.
One, if you have not fed a child.
How long does it take for a baby to be fed after delivery?
So the recommendation is within an hour of delivery, we should initiate breastfeeding. So skin to skin contact and breastfeeding. Sometimes there are challenges. So for a mother who is seriously ill and is unable to breastfeed or feed, the hospitals do try, and UGMC has a breast milk bank by the way, only in the country. So
I heard about
we
it.
do have that, so that's available. And then formula, you should probably start the child on formula if the child is fine, because the child needs to be fed, right? So, and I mentioned this earlier, if the mother's blood group is different from the baby's blood group, usually seen with mothers with O positive, they have a baby, the baby's A positive, B positive, then that's also more or less like a risk factor, or essentially a cause of the jaundice that we see.
When they are brought in, what tests you run? How do you confirm it? Are the yellow eyes enough to say that this is what we are dealing with, let's go straight ahead and manage or something?
So so first of all, clinically we look at the child, the yellow eyes, yellow skin, and we do a full assessment to see if the brain has been affected. So how is this child neurologically? So that assessment is done. We have a small machine that we can just put on the forehead. It's called a transcutaneous bilirubinometer. So the meter just means it's a machine. So it just instantly checks
to pick
the
up
level of the bilirubin.
There could be levels.
Yeah, so there are levels. And then maybe the most objective test will be checking the bilirubin levels in the blood. And for clinicians, we have a chart. So based on the child's how many weeks gestational age, so it's not everybody who is 38 weeks, 40 weeks,
Yeah.
or, you know, someone might be
Preterm.
35 weeks. So we have a chart for every gestational age,
okay.
and then based on your bilirubin levels and the day of life that you were born, we have what the normal levels are supposed to be. So on our chart, at a certain level, it's like, okay, you can observe there are levels that show that you need to start phototherapy, which is the major intervention, and there are levels that are so high that we need to do what we call an exchange blood transfusion, meaning that the bilirubin is so high in the blood, you need to actually exchange the baby's blood. So you take out the blood that is in and you replace the baby's blood with new blood.
How often is this done?
So I would say that about 10 years ago, working at the neonatal unit, every night we used to have at least one exchange. But I was just reflecting on it and I realized that in the past 6 years, I've just done 2 of those.
Okay.
Which makes me think that our advocacy is doing the work that
doing
it's
well,
supposed to,
yeah.
because it means that we are identifying it early and we are treating it early. I think the other challenge was initially we didn't have a lot of phototherapy machines, and so most kids had to be referred to the tertiary facilities, and by God's grace now many facilities have. We still need a lot of these facilities to have access to phototherapy machines so that they can actually start treatment wherever they are, and not have to wait, because these babies had to be referred. Some had to travel 12 hours just to get to a facility to have access to phototherapy machines. So I would say that advocacy is working. We've seen some improvements, but there's still more room because we still have kids who have the long-term complications of jaundice, and we want that to change because it is preventable.
Is every child that needs a phototherapy?
Once you have jaundice and we plot your levels on the graph, if you fall within phototherapy, we need to give you. But if not, some of them can be observed just to be sure.
What role does it actually play, the phototherapy?
Okay, so the phototherapy is like some kind of wavelength, light wavelength, and it's a process called photoisomerization. There are different processes, but this is the most common one, the photoisomerization, and it converts the bilirubin levels from an insoluble form to a soluble form so that the body can get rid of it.
Okay.
So basically that's what's happening. So there's a conversion that allows your body to excrete the bilirubin from the bloodstream.
Okay. That makes them wee a lot when they're under the lights.
Not necessarily, but whatever urine comes out, the bilirubin is going to come out with it. It's going to come out with it.
Okay.
Yes.
Okay. Well, it's just 40 minutes on top of that. I have here Dr. Anna Foko Buedu, pediatrician from Yeso Ghana Medical Center. We're discussing neonatal jaundice. We say thank you to our sponsor, Back Specialist Hospital and Fertility Center. This is the center for all your fertility, maternal and general health concerns. Their services include IVF, IU and other fertility services. They do child health and pediatrics, women's health and gynae, obstetrics and maternity, internal medicine, general OPD care, inpatient care. There's surgical service, that's both general surgery and also plastic surgery. They do theater service and laboratory and ultrasound scan services, amongst others. They are right here in Accra. Visit them in Taifa or call them on 0558 862 292 or 0592 196003. Back Specialist Hospital and Fertility Center. Integrity and excellence in health care. You are live on Facebook on Sunny TV. At home, watch us on Sunny TV at our Facebook pages. Kodo Tokoe on Facebook page, Sunny FM Facebook, and also Sunny TV Facebook page. You can join the discussion also. Let's have a very good time. Our phone lines have been open. Number to call us 0540 130 684 0540 130 684. My guest is here. Whatever it is, she will answer your question. Will have a good time. Now, people usually recommend sunbath. How safe is that? Does it work for people who you don't need the phototherapy, they don't need the blood transfusion? Does that option work?
So as a pediatrician, I would not recommend that as a form of treatment. And I think that every child who has jaundice needs to go to the hospital to have it checked out. Based on your levels, if you need to do phototherapy is not comparable to sunlight. So when there's a particular wavelength that we use for the phototherapy, it's light, but it's a particular wavelength. Also, the distance between the light and the child allows for maximum absorption. And all this has been calculated, all this has been studied. So using sunlight as a alternative to phototherapy does not work. And we would recommend that if you think your child has jaundice, please come to the hospital.
It can't be solved at home.
No, please come to the hospital, because now we're saying that once you spot it early, we can treat it right. Not just treat it, but give the right treatment for the child. And as I mentioned, a lot of studies have shown that in the African skin, using the skin as a means of getting right the diagnosis is not objective, because because of our skin color, you might not see the yellow as it's supposed to be seen, right? So we will recommend that we do the blood test, we check the levels, we check what is causing this. Because, for example, if you have something like G6PD, it's not just newborn jaundice you're going to have.
Yeah.
When exposed to other things, you're going to have jaundice even as the child grows up, right? So all of this has to be communicated to the mother. Counseling needs to be done.
Okay.
We need to find out what is causing it, and then we can recommend something and we can treat it right. Yeah.
I have this question from Jifa Lina Achieva. She's saying, good morning. Yes, good morning to Jifa. Please, my baby is almost 10 months, but his teeth has not come. Please, I want to know if it's normal. Thank you.
Okay.
Yeah.
This is not jaundice, but yeah, sometimes some babies do have delayed, like their teeth doesn't follow the normal. But then at 10 months, I think it's still normal.
It's
normal. You can just,
there's no cause for worry.
There's no cause for alarm yet. If this persists after like a year, she can visit the hospital and we can have a look at it.
Okay.
Yes.
Okay. Yeah. For newborn jaundice, is this something parents should be worried about? Does it have long-term effects in that, sometimes when you see the yellow eye, mothers will tell you when something ask you to put in your breast milk, it will solve it. So don't worry. I mean, it will get well. Should they be worried about this?
They should be worried, and I'm glad you asked this question, because the long-term effects of jaundice are devastating. So what happens when bilirubin has not been cleared is that we have something called the blood-brain barrier. It's able to cross into the brain, and as I mentioned earlier, it crosses the brain and stains the brain. It leads to something that it causes brain damage, and we call it kernicterus. Okay, so this kernicterus can lead to cerebral palsy, and we've heard about cerebral palsy. Yeah. It can lead to cerebral palsy. It can lead to permanent hearing loss. Permanent hearing loss.
Okay.
It leads to visual impairments, learning disabilities, developmental stones are delayed. So these are problems that's difficult to manage, because once the child has kernicterus, basically that's it. You sort of have to live a life of doing physiotherapy, occupational therapy, trying to help your child to have a good life. But this is something that could have been prevented once we had treated right. So I'll just encourage all mothers. Currently we have mothers. I just listened to, at our lunch, one mother shared her story about how she was seen somewhere. She was referred. By the time she got to the hospital, it was too late. It had gotten to the brain. Currently, the child has cerebral palsy. She has started physiotherapy. Child is 2 years, is yet to sit up on her own. And these are all really devastating, and this is why we are actually advocating, because no child has to go through something that could be easily prevented.
I'm sure in your years of practice, there's been some myths that mothers come in to talk about. Yes. Are there any you want to correct or address here?
Yeah, so maybe two. One, using sunlight to treat jaundice. That's something
whose idea was that then? Who brought it up?
I don't think that, it's a brilliant idea, only that it's not as effective, because the principle of the phototherapy, the principle of the phototherapy actually follows the sunlight. It's just that using sunlight is not effective. So that's something we'd like to correct. And the other thing is using of breast milk on the eyes.
Breast milk,
and that doesn't make any difference.
It doesn't do anything.
It doesn't do anything. So we would recommend that
bring baby in.
Please bring baby in so that we can see and treat appropriately.
Yeah. What's your theme for this year?
So I'm going to read this out loud. So our theme is a national call to action improving jaundice care for every newborn everywhere. Every newborn everywhere. And we are using this because we recognize that not everybody is in the big cities. There are people who are in the rural areas. And unfortunately, many of these rural facilities, and our pediatricians, they are advocating for phototherapy machines, because you could have a pediatrician in a rural facility. She needs a phototherapy machine to work, but she does not have one, so she has to refer. Sometimes you refer patients and they don't even show up because they have to travel a long distance to get to it. And
So what happens then if they don't show up?
If they don't show up, then if they have effects of jaundice, then that happens, which is sad. So we want to make sure that every child everywhere has access. So we want to educate mothers. We are doing community awareness. We are our midwives are helping. Pregnancy schools, we are teaching about jaundice, how to recognize it, and we are encouraging supports from government, from NGOs, people who would like to donate phototherapy machines to facilities can do so. They can reach out to the Pediatric Society of Ghana, and we can share some places that will benefit from, so that people in faraway places, far away from the city, also have this healthcare access.
Okay.
Yes.
Over the years, I can tell that, and this is actually the 5th year we've discussed jaundice.
Yeah.
There's been a lot of advocacy, like you had mentioned. Has it actually made any impact? Are you reaching out to the mothers, the caregivers? I think maybe in Accra is better. The numbers might be better.
Yes.
But those who are outside there who do not have access to this education, I heard about jaundice when I had my firstborn. I'm proud that there was zero knowledge about jaundice. Are the mothers aware of this? That I even heard about comfort doing something. Are they aware of this, so they're proud when they are pregnant, during their baby time, they are preventing and avoiding this? How has it gone down over the years?
So maybe I'll start from the comfort part.
Okay.
So comfort is sulfur is what we call naphthalene ball, sulfur containing as well as sulfur containing drugs. G6 patients with G6PD, when they come into contact with this, their red blood cells begin to break down, which is why we sometimes tell new mothers, don't put camphor in the clothes because you haven't even tested if the child has G6PD.
So this is even before baby comes. Don't use a camphor.
So if the mother, so usually it's transmitted. So if the mother has G6PD, she probably should not be using camphor anyway, right? So once the baby is born, we do recommend that do not start camphor use, because you do not know what your baby has, right? But I will say that advocacy is working.
It's working.
There's still more grounds to cover, and we are still working on that, because now we are sending people to faraway places at the regional level. The pediatricians and then the pediatric nurses and all other members of Pediatric Society are coming together to do this education, trying to reach the far to reach areas. So I will not say that we have hit our target yet, but we are working towards it. Midwives are also helping at the antenatal level to try and educate mothers about jaundice. We are educating on our level as well for pediatrics. But of course, when it comes to prevention, you always have to start from the education. Primary prevention, we always say,
it can be prevented, right?
Yeah.
Okay.
I mean, primary prevention is education.
It's key.
Because before you have a child, you should know about jaundice. And many parents only find about jaundice when they have a baby who has jaundice. So before you have a child, every
antenatal,
every child, in fact, if you're in the university, you should know about jaundice.
Okay.
If you're in senior high school, you should know about jaundice. And more so for females, so female empowerment and female education, we should know about jaundice even before you get pregnant. And when you get there, it's not something shocking and it's not something new. So our focus is not even just on mothers or pregnant women, but just education the public, because one day you will have a sister who would go and give birth, or you yourself as a man, you would have a child who has jaundice, and it's like, oh, they didn't teach me because as a man I didn't go for antenatal with my wife, right? But we are doing public education. Whoever you are, you need to know about jaundice, because next time it could be your child having jaundice.
Some 6 years ago, unfortunately, I happened to be in it was Ridge Regional Hospital, Niku, and overheard two women talking. I think she had a baby in a private hospital.
Right.
It was vaginal, so of course she went
She went home.
So before she left, she told the nurse, "Nurse, me baneni so yellow." The nurse like, "Oh, and Kofi, you Kofi." Then she found herself back in Ridge. It was jaundice.
Right.
So it means, I mean, what's happening? Now she's going to bear, if God forbid, if it's not born, there's no damage. She's going to bear this for the rest of her life.
Yeah. So I'm so sorry to that mother, and I think that her healthcare professional at that time failed her.
Yeah.
So whilst we are doing this education, it's not just for the
mothers, the community,
but internally we are doing a lot of newborn jaundice, what we call CPDs and education for healthcare professionals. So it's something that we are going over again and again. We have one coming up next week for doctors and for nurses on how to recognize it, because we need to keep learning. There are people who are new, they don't have the experience.
First
and as
time
I
moms,
said, even the healthcare professionals, let's say you bring a new nurse, she probably does not have the experience, not really her fault, but we are teaching all levels, nurses, doctors who are new, everybody, just how to recognize it from the beginning, because that person doesn't know how it looks like. Sometimes they want wait for it to become so yellow before they can actually identify it. So the education is also going for the healthcare professionals, and we do not have to fail our patients. Yes.
It's 10 already. They are signaling me. What's the most important message you want every mother, not just mothers, fathers, aunties, sisters, to remember about newborn jaundice?
That it is treatable, it is preventable. We should come to the hospital as soon as we see anything untoward with our children, and it's not just with the yellowing. Your child is not feeding right. Don't worry about being a fussy mom or a fussy dad. Just show up to us. We will take care of you. If the child is fine, you can go home with peace. But if your child has something, we can actually spot it early and treat it right.
Okay.
Yes.
There's a last question. I want us to do this quickly. Asking whether babies can have it later on in life if it's not treated well.
In terms of having it later on, you can have jaundice from other causes, because whenever you have liver diseases, it can result in jaundice. And there's a part of the jaundice that we haven't talked about. So maybe another time. But you can have jaundice at any point in time. Adults can have jaundice. Chronic liver disease can cause jaundice. And in children, there's something called biliary atresia, which is also very common. And for that jaundice, it can be there. It's one of those jaundice that you don't have to do phototherapy. And maybe I'll just chip in that the main thing you need to notice is the color of your baby's stools. So that's one of the key things. Is the baby passing yellow? Usually we see greenish or yellowish stool. If your baby's stool is whitish or like clay, you need to come in as soon as possible, because we need to intervene. But yeah, you can have jaundice later on in life from something else. But if we don't treat it right, then you're probably going to have the complications of jaundice. Yes,
thank you so much. Thank you. It's been nice having you here.
Yes.
Thank you. And then thank you to all those who listen, those who watch on TV, to the guys here. Don't forget, same time tomorrow morning, 9:30 on Sunny TV. Have a repeat broadcast. Have a good working day and stay blessed. Bye-bye.
Bye.
Lift up your spirit at 88.7 FM.
You're listening from Praise the Lord Nation. We'll discuss it all. Maternal health, vaccinations, infant nutrition, preventive care, mental, physical, and emotional wellness of both mother and baby. We talk about what truly matters here. Tune in to Sunny 88.7 FM and also on Sunny TV every Friday morning from 9:30 a.m. to 10 a.m. Also